course, like, resuscitation medications and vasoconstrictors. So I guess our main vasoconstrictor agents would be things like phenylephrine, ephedrine, epinephrine, norepinephrine. All those have their own kind of slightly different profiles, which again, probably you guys don't need to know. But all those, there's always considerations for what we might use for certain patients. Yeah. So any questions with it, to any of those other kind of, let's say, more non-standard medications that we see in the lot of these days? Not really. All right. Okay, and I guess that's kind of pretty much everything. But open floor if you guys have any more questions.
So, if we have a trauma case, what should we prepare?
Should you prepare?
Outline.
Yeah, it's very patient dependent, but typically, so for a bad trauma case, I would say that 2 IVs and an arterial line and a fluid warmer. So yeah, that's usually what I would. That's what I would do. Probably fluid warmer for any trauma case would be a good one. And then the rest really kind of relies on the patients. Even honestly, when I was in Toronto and kind of doing these cases, the nurses wouldn't really set up much of my stuff for a trauma. I pretty much do most of it. But yeah, I would say that if anyone asks you to help out with setup, an easy default is just getting a fluid warmer already, because we know that for trauma patients, one of the main goals that we have is to have normothermia in that patient, because the potential for coagulopathy in a patient who is hypothermic. So you should pay particular attention to the patient's temperature for the course of the next life after trauma case. And we know that for trauma patients, oftentimes there's already been environmental exposure because of the fact that they're probably, let's say it's a snowmobile accident. Well, they might have been laying in the snow for an hour before they were extricated. Same thing with car accident things, particularly during the fall through to late spring. So fluid warm, I would say, is an easy default